As discussed in the previous video, we know that evidence-based practice mainly involves 5 steps. In this video, we will be covering the first step, which is converting information into answerable question. Structuring a question is done to find a scientific answer. Now, why is it important? It provides focus to thinking, which helps in formulation of search strategies. This is later used for the purpose of critical appraisal, that is, evaluating the quality, relevance, and credibility of published studies to assess the strengths and weaknesses of research article. The concern of a clinical question is categorized into 5 parts: effect of intervention, experience of patient, etiology, prognosis, that is, course of treatment, and diagnosis. To understand it better, let's take an example of a patient having frozen shoulder. So, the questions a physiotherapist can ask will be in the following order: does physical therapy help improve range of motion? Does patient report pain relief and satisfaction? What are the risk factors for developing frozen shoulder? What is the course of frozen shoulder treatment? And what are the most reliable diagnostic criteria or tests for frozen shoulder? Converting information into a question is done through breaking it into parts. The first part is effect of intervention. These questions are more specific and focus on a particular aspect of patient care. They are typically structured using the PICO framework, which stands for patient or problem, intervention, comparative intervention, and outcome. For example, in patients with hypertension, does regular exercise compared to medication reduce blood pressure? The second part is patient's experience, which can relate to any aspect of clinical practice. For example, patient's attitude towards his condition, such as comfort, convenience, and overall satisfaction with the treatment approach. Impact of intervention on the patient's quality of life. The third part is prognosis, which addresses the long-term outlook associated with the intervention, aiming to minimize the likelihood of recurrence or exacerbation of symptoms following the treatment. And the fourth part is diagnosis, that focuses on the potential benefits of accuracy of diagnostic tests. Early identification of these complications allows for timely intervention and prevention of further progression. To understand it better, let's take an example. In middle-aged adults with chronic plantar fasciitis, does a combination of stretching exercises and orthotic inserts compared to stretching exercises alone results in faster pain relief and improved functional outcomes, better patient satisfaction, reduced risk of recurrence, and accurate diagnosis and classification of plantar fasciitis subtypes?